There's a pill for that. It seems that any complaint we have results in one or more pills prescribed. We end up with medication from different doctors that may not play nicely together. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Medical foods can help manage chronic conditions by addressing the metabolic deficiencies associated with diseases. They're intended for use under medical supervision. In today's video, we'll discuss how medical foods can be used to treat different foot and ankle issues. But before I do let others know about these videos, please like, comment, hit the subscribe button, and share on social media. This will help others find the information. Medical foods are considered a unique category regulated by the FDA. Medical foods can help manage chronic conditions by addressing the metabolic deficiencies associated with diseases. Unlike supplements that you'll find in the pharmacy, these are intended for use under medical supervision and require a prescription. Medical foods are used specifically for the management of distinct nutritional needs resulting from a specific condition. They work well as an alternative to those who can't tolerate pharmaceuticals or for those who prefer an alternative. One area where medical foods are particularly useful is to treat the symptoms of peripheral neuropathy. Imagine stepping on a tiny pebble without even flinching. Sounds odd, right? That's peripheral neuropathy in a nutshell. It's like your feet have gone radio silent, ignoring sensations they shouldn't. Picture it. Your feet are trying to send urgent messages to your brain about pain, temperature, and balance, but those messages get scrambled, delayed, or just plain ghosted. The result? Numbness, tingling, and a whole lot of frustration. Peripheral neuropathy is nerve damage. When these nerves are healthy, they work like superhighways, transmitting info between your feet and the brain at lightning speed. But with neuropathy, those highways become bumpy back roads, full of potholes. Some signals make it through, some don't, and some get all tangled up, leading to weird symptoms like burning pain or the sensation of wearing socks when you're barefoot. This condition often starts sneaky and slow. Maybe it's just a slight tingling at first or the occasional feeling of pins and needles, but then it escalates. One day you might notice your feet are numb, or worse, you might get a cut, blister, or sore on your foot and not even feel it until it becomes a serious wound. That's why neuropathy isn't just annoying, it's dangerous. So what causes it? For many, it's diabetes. In fact, high blood sugar is like kryptonite for nerves. But that's not the only culprit. Chemotherapy, alcoholism, certain autoimmune diseases, and even vitamin deficiencies can take a wrecking ball to your nerve health. And once the nerves are damaged, they don't just grow back like hair or nails. It's more like trying to repair a frayed electrical wire. Possible, but tricky. The good news, there are ways to manage it. Using medical foods is one way. For neuropathy, I use a medical food that combines several ingredients. L-methylfolate calcium increases blood flow and aids in nerve repair. Vitamin B12 increases peripheral nerve repair. Vitamin B6 reduces harmful substances that can damage the nerves. Alpha Lipoic Acid increases blood flow to the peripheral nerves and decreases inflammation. Vitamin D3 increases factors involved with nerve health. Vitamin B1 reduces pathways involved in damaging blood vessels and peripheral nerve. Finally, riboflavin, along with some of the others I already mentioned, decreases homocysteine levels, which helps to protect your arteries. Medical foods are different from pain medication. While pain medication can help to mask painful symptoms, they have a variety of side effects and do not address what's causing the pain. The active ingredients work together to naturally restore blood flow and to help repair damaged nerves. Because these ingredients work to address the root cause of your symptoms, it might take up to 6 months before you notice a difference. Once your metabolic needs are met, you may notice a difference in numbness, burning pain, shooting pain, tingling, or poor quality sleep. Another area where medical foods are helpful is to heal musculoskeletal injuries. Imagine this. You're out on the tennis court chasing down a fast serve and pop, a rolled ankle. Or you're just going about your day, taking a wrong step and snap. A fracture lands you in a boot or on crutches for weeks. Sprains, fractures, and other musculoskeletal mishaps can happen in a split second, And while rest and rehab are crucial, there's another layer that too many people overlook: nutrition. We're talking about targeted medical foods, specifically formulated nutrients that go straight to the heart of the tissue repair, inflammation reduction, and even pain management. Imagine giving your body exactly the building blocks it needs to mend those tiny cracks in your bone or speed up the healing of that strained ligament. That's what medical foods can do. Here's the kicker: your body isn't just a passive healer. When you experience an injury, it's like your cells throw a biochemical party, but not the fun kind. It's an inflammatory rave that, left unchecked, can slow down healing and leave you more vulnerable to future injuries. That's where the right medical foods come in. They're packed with nutrients like amino acids, vitamins, and plant-based anti-inflammatories that tell your body, hey, calm down, let's fix this. Take a simple ankle sprain, for instance. Most people ice it, elevate it, maybe pop some ibuprofen and call it a day. But with medical foods, you're not just sitting around waiting for your body to do its thing, you're actively fueling your recovery. Or consider fractures. Bone health isn't just about calcium, despite what every got milk commercial ever told you. It's about providing the right mix of calcium, magnesium, vitamin D, and even lesser known nutrients like vitamin K2, which helps direct calcium to where it needs to go: your bones, not your arteries. The medical food approach goes beyond the basics, offering a concentrated formula designed specifically to support bone formation and speed up the healing process. Faster recovery means getting back into your activities sooner, with less risk of re-injury. Treating musculoskeletal injuries isn't just about splints, braces, or PT. It's about a whole body strategy. Thinking of it like fixing a pothole on a road. You don't just fill it up and hope for the best. You reinforce it, seal it, and make sure the foundation is stronger than before. That's what targeted nutritional support can do for your bones, muscles, and ligaments. Ingredients in the medical food I use for musculoskeletal recovery include calcium citrate, which increases bone growth and nerve and muscle function. It also decreases bone loss. Magnesium bisglycinate increases vitamin D absorption and improves bone density and health. Vitamin D3 increases calcium absorption, and zinc bisglycinate increases bone cell and collagen production. So next time you're sidelined by a strain or stuck in a cast, don't just sit there waiting for the weeks to pass. Consider adding some nutritional firepower to your healing arsenal. Because when it comes to musculoskeletal recovery, every little bit of support counts. The final area we'll discuss where medical foods can help is treating brittle, discolored, and irregular toenails. You stare at your toenails and they look like they belong to someone else. You try those over-the-counter creams, the polishes, the soaking routines that supposedly transform your nails back to normal. But nothing seems to work. Why? Because the problem isn't just on the outside, it's an inside job. The truth is, your toenails are like little windows into your nutritional health. When they turn yellow, split, or crumble, it's your body's way of screaming, "Help, I'm running on empty." This is where medical foods come in. Let's get one thing straight. Brittle, irregular toenails aren't just a cosmetic issue. They're red flags that something deeper is off balance. But here's where medical foods come in like the ultimate repair crew. These targeted nutrients are formulated to fill in the gaps that regular diet and run-of-the-mill supplements can't touch. Imagine them as a blueprint, directing your body to restore nail health one cell at a time. Here's the thing. You can slather on all the topical treatments you want, but until you tackle the root cause from the inside, you're just putting a Band-Aid on a deeper problem. With medical foods, you're targeting the deficiencies that have been scientifically proven to promote nail health, not just mask the damage. The medical foods I use to improve toenail health include biotin D and hydrolyzed type 1 collagen, both of which improve the thickness and strength of the nail. Cytidine HNS improves nail strength, thickness, and elasticity, moisture retention, and regulates nail color. L-methylfolate calcium improves the blood flow, nail growth, and regulates nail color. Finally, silicone is added to improve nail strength. So the next time you catch yourself hiding your toes in shoes all summer long, don't think polish, think nutrition. You don't need a new color, you need a new approach. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you think that adding a medical food will help with your foot or ankle conditions, it's worth a try. We've gotten great results and keep finding more uses. Contact the office and we'll set you up for a consultation. The link to request an appointment is in the description. Thanks so much for watching and have a great day.